So what I want to tell you, sir, now we are going to talk regarding our clinical points. So try to understand, we are going to talk regarding the os paralysis. Yes, as we had seen, the nerves are coming from the C5, yes, C6, then upper trunk is formed, correct sir, and then it is dividing into the anterior division and posterior division, and at that part there was the our suprascapular nerve and nerve to subclavius. So remember, in your exam this os palsy will be asked as the, yes, short note. So total 1, 2, 3, 4, 5, 6. 6 nerves are meeting together. So remember, what is os paralysis? Yes, whenever there is the injury in between head and shoulder here, then it is our os paralysis. And whenever there is an injury at this axilla part, sir, it is Klumpke's paralysis. We all know C5, C6, C7, C8, T1. Yes, sir. I told you earlier, sir, this was the image from the our cervical and the shoulder part, between the head and shoulder. You can remember the head and shoulder shampoo. If there is an injury at this part, there is os paralysis, and if there is the injury at this axilla part, sir, here is a Klumpke's paralysis. Sir, C5, C6, C7, C8, T1 ऐसे 5 उंगलियां आप रख सकते हो. These are coming through this our neck part. तो अगर यहां पर डैमेज हुआ तो कौन डैमेज हुआ? C5 हुआ और C6 हुआ. ओके सर. लेकिन अगर नीचे डैमेज हुआ तो कौन गया बेटा? ये C7 था, ये C8 था. यस, C8 और T1 डैमेज हुआ. सो दैट इज आवर Klumpke's paralysis. ओके, यस. सो आफ्टर दिस os paralysis description, you have to say what are the different headings. You have to say about the os point. ये हेडिंग में आप लिखेंगे os point. What is the os point? Sir, meeting of the 6 nerves. Then cause, you have to say about the headings properly. Yes, what are the different cause? Excessive stretching in between the head and shoulder. तो कभी भी हेड और शोल्डर के बीच में चोट लगी तब होता है. Yes, just like if anyone is falling from the height. And in the similar way, integrating with the ops gynae, जब किसी बेबी की ऑप्स गायनी डिपार्टमेंट डिलीवरी हो रही है और उसका हेड को पकड़ के जोर से खींचा गया, सो एट दैट टाइम देयर इज द इंजरी इन बिटवीन द हेड एंड शोल्डर. दिस इज आवर शोल्डर डिस्टोशिया. सो इन अ फनी वे, यू नो, हम डॉक्टर तो बेवकूफ होते हैं, ये जो इंजीनियर वो सब कर सकते हैं. सो इन योर 3 इडियट मूवी यू हैड सीन दैट आवर ग्रेट इंजीनियर्स दे आर डूइंग द डिलीवरी. But the second part of this movie will come, and that will be the os paralysis. Okay, yes, जब engineer या फिर unskilled hand they are doing the delivery of the baby, at that time there is the abnormal excessive stretching between head and shoulder, and the nerves which are coming in between head and shoulder means our brachial plexus, especially the upper trunk, it is getting damaged. So this is the another beautiful integration with the ops gynae. Yes, conceptual brainstorm integration. Okay sir, so these all are the our injury. Now try to understand what are the our different nerves which are involved, and there is the injury. Sir, there is the our os palsy. So in os palsy there is the damage to which part? Sir, upper trunk is damaged. So there is a C5, C6. Yes sir, it is getting damaged. Now tell me, what are the important nerves which are having the C5, C6 root value? Answer is axillary nerve. Yes sir, axillary nerve is having the C5, C6 root value. So it is supplying which muscle? Sir, it is supplying the deltoid muscle. Deltoid is getting paralysis. Yes, MCQ viva question. Another is our teres minor is getting paralysis. Okay, now try to understand. Deltoid is located over the shoulder part. When it will contract, it will cause abduction. So there is a damage to the deltoid. There is the our loss of abduction. Yes sir, due to the deltoid paralysis there is the loss of abduction. So patient will present with the abducted arm. This is the your viva question. This is your viva question. This is your viva question. Nerve supply, axillary nerve. This is your viva question. So in the single flow chart is important. You can crack the 4 your viva question and MCQs. That's why you can see, if baby is taking birth, he will present with the first point. Sir, there is our abducted arm. Agree everybody? Now, yes. Teres minor. Teres minor is lateral rotator. I am showing you the 3-dimensional orientation. Sir, this is our back side. This is the deltoid muscle. And you can see this is scapula. Here is our humerus. This is the teres minor muscle which is getting insertion into the our yes greater tubercle lower impression. So try to understand, जब ये मसल कांटेक्ट करेगी तो ह्यूमरस जो है ऐसा बाहर रोटेट करेगा. yes it will rotate outside. Getting the point? So remember this teres minor muscle is outer rotator or you can say lateral rotator. But if axillary nerve is damaged, if upper trunk is damaged, then teres minor is paralyzed. So patient will present with yes medial rotated arm. सबको समझ में आ रहा है बेटा? समझ में आ रहा है तो just give me the thumbs up, just give me the any kind of the emojis. Okay, yes 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 you are right. So teres minor paralysis, it will cause yes there is the loss of lateral rotation. Agree? Yes, thank you Richa, Ujma, Shreya, thank you. So this is the MCQ viva question. Due to the loss of the lateral rotation, patient will present with the medial rotated arm. This is another your question. Okay, fine sir. Now look, more nerve sir, musculocutaneous nerve is also getting damaged. Agree sir. Now this musculocutaneous nerve, it is supplying the biceps. So there is a biceps paralysis. Agree? I'm making the flow chart for your university exams also. Sir, biceps paralysis, biceps is responsible for the flexion of the elbow. Yes. So there is the flexion loss. Viva question. Okay. Now remember, sorry. Okay. Whenever I will sneeze, remember that will be the important question. तो आपके एग्जाम में ये ऑस पैरालिसिस या तो थ्योरी में आ रहा है या फिर आपके प्रैक्टिकल वाइवा एमसीक्यूज में आ रहा है, बट इट इज वेरी इंपॉर्टेंट. ओके, आई एम जस्ट किडिंग बट यस इट इज इंपॉर्टेंट. नाउ सी, biceps is also powerful supinator. Yes sir, that's why there is the loss of flexion, so there is the extended elbow. Another question. Also remember sir, this biceps is yes thank you Richa, thank you. Okay, so biceps is also powerful supinator, so there is a supination loss. So patient will present with the pronated hand. Yes sir. So you can see here sir, there is the another presentation. Yes sir, it is our medial rotated arm. Getting the point? Also you can see there is third point sir, extended elbow. Okay, also you can see there is a fourth point, that is our pronated hand. Getting the point? Yes thank you Ujma, thank you for your thumbs up. What I want to tell you sir, musculocutaneous nerve is damaged, that's why biceps is paralyzed. Also remember beta, the brachialis, which is the chief flexor of the elbow, it is also getting paralysis. So it is also resulting in the same thing, loss of flexion. So elbow is presenting with the extended portion. Now see here, yes sir, there is our, what are the different situation? Adduction, medially rotated, pronated, and our extended elbow. Also remember the C5 C6, it is participating in the radial nerve. Radial nerve is supplying the supinator muscle. Yes, so supinator is also getting affected, that's why you will say there is our pronated hand. Yes sir, these are the more MCQs. Radial nerve, it is having the all the roots. Okay, that's why. So this is your beautiful flow chart. अगर बेटा ऐसा आप लिख देते हो एग्जाम में तो डेफिनेटली आपको बहुत जबरदस्त मार्क्स मिलेंगे. ओके, सो दिस इज योर फ्लो चार्ट. नोट्स अगर एग्जाम में बेटा आप ऐसे लिखते हो तो वो उतना इफेक्टिव नहीं होता, बट इफ यू आर राइटिंग द प्रॉपर फ्लो चार्ट, यू आर गिविंग द एक्सप्लेनेशन, यू आर हाईलाइटिंग द इंपॉर्टेंट थिंग्स, प्रॉपर कलर कोडिंग, इट विल गिव द बेटर मार्क्स. ओके, यस उजमा, यू आर लाइकिंग दिस ऑल द नोट्स, थैंक यू फॉर दिस. ओके, चलो आगे बढ़ते हैं. नाउ वी आर गोइंग टू लुक दिस पोजिशन. सी हियर, एक बच्चा है जिसका हाथ एडक्टेड है, यस, मीडियली रोटेटेड है, एक्सटेंडेड है, प्रोनेटेड है. अगेन आई वांट टू टेल यू सर, एक्सिलरी नर्व हो गया, सो देयर इज अ डेल्टॉइड पैरालिसिस, तो पेशेंट जो है हाथ को एबडक्ट नहीं कर सकता. ओके सर, एडक्टेड आर. Now, teres minor is paralyzed, so patient cannot lateral rotate, but there is a medially rotated arm. Okay, sir. Musculocutaneous nerve has been gone, so patient cannot flex the elbow. There is an extended elbow. And teres minor has gone. Yes, sir. The biceps has gone. Yes, sir. The supinator has gone, which are the powerful supinator. So patient cannot supinate. He will present with the pronated. So this is the position. Now this position is just similar to this hand. Tell me what is the name of this position, sir? This is our police tip hand deformity. आप बिना हेलमेट के हाईवे पे चले जा रहे हो, पुलिस वाला आपको देख लिया, रोक लिया, मांगता 10,000 जमा करो, आप क्या करोगे? कहां लगाए रखे हो भैया, ये 500 रुपए पकड़ो। तो पुलिस वाला रिश्वत कैसे लेता है? यस, याद रखो, पुलिस वाला कभी भी रिश्वत पैसे दो ऐसा नहीं लेता। यस, एबडक्शन करके नहीं लेता, वो चिपका के लेता है हाथ को। ओके, कभी भी फ्लेक्स करके नहीं लेता। यस, एक्सटेंडेड एल्बो से लेता। कभी भी रिश्वत आगे से नहीं ली जाती। यस, रिश्वत पीछे से ली जाती है। हैंड इज इन सच काइंड ऑफ वे। यस, यू हैव टू put, you have to keep the money and immediately you have to put in the pocket. Can you see? It is very close to the pocket and immediately, yes, I cannot show my hand in the screen. Yes, just hold the money and put in the pocket. So this is the adduction, medial rotation, pronated hand, and remember extended elbow. Hold the money and immediately put within the pocket. Getting the point? So this is yes, Richa, Ujma, Shreya, you all are enjoying. So thank you for your emojis. This is our police man tip hand. Very most important. Now in the similar way, yes, I'm just kidding for all of you so that you can remember another thing. फर्स्ट MBBS निब्बा निब्बी, यस, बचपन का प्यार मेरा भूल नहीं जाना रे. So they are going to the hotel and Nibba is asking for the corner seat to the waiter. Waiter is saying, nahi sir, all the seats are reserved. Now what the Nibba is doing? Nibba is giving 50 rupees. Now waiter is saying, sir, आप ही के लिए तो बुक है. Yes, so holding the money within the pocket in the same position, adduction, yes, extension, medially rotation and pronated hand. So this is also known as, yes, Shreya, Uzma, Richa, I need more new person. बेटा जितना ज्यादा आप लोग इन्वॉल्व होगे उतना अच्छा होगा. हम सभी मिल करके एक नया सेगमेंट स्टार्ट कर रहे हैं, एक नई शुरुआत कर रहे हैं पूरे आपके एमबीबीएस लाइफ के लिए. यस, अभी हम कम हैं, लेकिन क्या गम है, धीरे धीरे हम 50 के 100 होंगे, 100 के 500 होंगे, 500 के 1000 होंगे और भीड़ लगेगी यहां पर. यह मेरा आप सभी से वादा है. एक दिन आएगा कि इस क्लास को अटेंड करने के लिए बहुत सारे लोगों की भीड़ लगी रहेगी और उस दिन के शुरुआत में मैं ये कहूंगा कि पहला दिन था, उस दिन श्रेया थी, उजमा थे और रिचा थे जो कमेंट पे कमेंट कर रहे थे. तो मुझे ये 3 बच्चों के नाम तो बिल्कुल याद रखेंगे. यस, इंशाल्लाह रिचा, उजमा, थैंक यू एवरीबॉडी. तो मैं आपको कहना चाहता हूं, यस, दिस इज योर, यस, पोलिस man tip hand. Also you can say the waiter, also you can say porter. Yes, waiter और porter एक ही चीज है. porter's tip hand. Getting the point beta? Yes, thank you Ushma. Yes, Shreya, perfect. So you must remember. Now we are going to talk regarding the Klumpke's paralysis and I want to tell you, recently in AIIMS exam, INICET exam, this question had been asked. ये सारे क्वेश्चन कहां से आते हैं? हमारे फर्स्ट एमबीबीएस के थ्योरी से आते हैं. Now try to catch this point. If any person is falling from the height, ओके सर, ये बोलता है मैं तेरे लिए जान भी दे सकता हूं, ऐसा बोल करके वो कॉलेज की बिल्डिंग पे चढ़ और कूद गया. लेकिन अचानक जब वो हवा में था तो उसको याद आया, यार जान बहुत कीमती चीज है, नहीं देनी चाहिए. सो व्हाट ही विल डू, ही विल होल्ड एनी ऑब्जेक्ट which is coming in his path. Now suddenly, due to holding, entire body is getting fixed, but due to the gravity there is the excessive stretching at the axilla part. What you have to remember, there is excessive stretching at the axilla part. And I again want to tell you, C5, C6, C7, C81. Can you see C81 at the axilla? So when there is the damage to the axilla, which nerves are getting damaged? Sir, C81. Can you see the baby is coming out and there is the unskilled person, just like the 3 Idiot movie. Rancho, Farhan, Raju, they are saying चल निकल, मुझको वायरस से पेन लेना है, चल निकल. So what will happen? Yes, the baby will get injury at the axilla. Which nerves are getting damaged? Sir, Klumpke's paralysis, C8T1 damage, which is located at the lower trunk. You can say lower trunk damage. And which nerve is participating? Sir, ulnar nerve is participating. Okay, so remember due to the C8 T1 damage, the ulnar nerve is getting damaged, and this ulnar nerve is resulting in the damage of the third and fourth lumbrical. I will teach you. There are the four ascaris lumbricoid like muscle, very thin ascaris lumbricoid like muscle. They are राउंड वर्म लाइक इन अपीयरेंस, इसलिए बेटा उसको हम lumbrical कहते हैं. Are you getting the point? Lumbrical lumbricoids. Yes sir. So remember these lumbricals are four in number. First lumbrical, second lumbrical, third lumbrical, fourth lumbrical. Getting the point? Yes. The first and second lumbricals, sir, these are supplied by median nerve, while the third and fourth lumbrical supplied by ulnar nerve. I will tell you one story. जो नदी जहां रहती है, जहां बहती है, उस एरिया को सप्लाई करती है, क्योंकि थंब की तरफ से मीडियन नर्व की नदी बहती है, तो फर्स्ट और सेकंड लुम्ब्राइकल को कौन सप्लाई करेगा? मीडियन नर्व. बट फ्रॉम द अल्ना साइड ulnar nerve is coming, so ulnar nerve will supply the third and fourth lumbrical. What is the function of this lumbrical? These are responsible for the pain holding position. Yes, these are responsible for the babaji ka thullu position. So you can remember these lumbricals are responsible for the flexion at metacarpophalangeal joint, and these are responsible for the extension at interphalangeal joint. So if the median nerve and ulnar nerve both are getting damaged, iska ulta karo beta. Yes, the site where there was the flexion do the extension, and the site where there was the extension do the flexion. So this is complete claw hand. Complete claw hand is found where, sir? In case of the median and ulnar nerve damage. But in Klumpke's paralysis, only the ulnar nerve is damaged, so only the third and fourth lumbricals are paralyzed, so only the ulnar claw hand is seen. So this is a very very famous question, better don't forget it. Agree everybody? Sir, this is our ulnar claw hand. Getting the point? Yes, आमिर खान सर को सदमा लग जाएगा. रिमेंबर दिस खान ब्रदर्स. यस, SRK आमिर खान साहब. और सबसे बेस्ट है हमारे सैलमॉन भोई. आज गाड़ी तेरा भाई चलाएगा, बहुत मजा आने वाला है. ये हम फर्स्ट MBBS निब्बा निब्बियों के लिए सबसे बड़े भगवान है कौन? सैलमॉन भोई. ओके, सो वी विल मीट विद दिस ऑल. यस, बेनेडिक्ट साइन वी विल सी लेटर बेटा. यस, दैट इज द हिल्टन लॉ. ओके, यस यस यस, यू ऑल आर राइट. Okay sir, so this is the your Klumpke's paralysis. But remember, there is a damage to the T1, and this damage to the T1 is resulting in, tell me better, what is this? Drooping of the eyelid, that is the ptosis. There is the constricted pupil, that is our, yes, meiosis. Very good, very good. Shreya is answering very quickly. Sir, this is our what? Horner's. Yes sir, it is our Horner's syndrome. Okay, so this is the ptosis. So always you will listen any kind of a song. What is the ptosis? Sir, झुकी हुई आंखें. So you will listen the song. झुकी झुकी सी नजर बेकरार है कि नहीं. अरे भाई, कोई झुकी हुई नजर नहीं है, कोई बेकरार नहीं है. टोसिस हो गया, हॉर्नर सिंड्रोम हो गया. अदरवाइज यू विल लिसन द सॉन्ग. ये तेरी आंखें झुकी झुकी, ये तेरा चेहरा खिला खिला, बड़ी किस्मत वाला है वो, प्यार तेरा जिसे मिला. रिमेंबर, अरे भाई कोई झुकी हुई आंखें नहीं है, उसको टोसिस हो गया, डॉक्टर पास भेजो, इलाज करवाओ. रिमेंबर दिस झुकी झुकी सी निगाहें, दैट इज अवर टोसिस. डोंट फॉरगेट इट. इट इज द क्लासिकल फाइंडिंग ऑफ द हॉर्नर सिंड्रोम. गेटिंग द पॉइंट बेटा? ओके, सो व्हाट आई वांट टू टेल यू, सर, क्लम्की's paralysis. Klumpke's paralysis is equal to, sir, partial claw hand plus Horner's syndrome. This combination is our Klumpke's paralysis. But now I am going to tell you with the ophthalmology integration ki why there is a such kind of a thing. Yes, why Horner's syndrome. So this is your ophthalmology. I am teaching you with the next pattern. Yes, conceptual brainstorming integration. Try to understand, this is our ophthalmology integration. Okay, how? See here, we had seen in our Klumpke's paralysis C8 and T1 damaged. Remember, you will see in physiology, sir, T1, this is our sympathetic nerve to head, neck, face. You all know that sympathetic system is thoracolumbar. So from here the nerves are coming and they are supplying the sympathetic innervation, while the parasympathetic is cranio and sacral. Agree? Physiology integration. Now try to understand, head and neck part, it is getting the sympathetic innervation by what? Remember beta, the T1. यहाँ पर पास में कौन है? T1. तो क्या L1 L2 से आएगा? नो सर, रिमेंबर बेटा, इट इज अ वे, वन लॉ आई विल टीच यू, जो नदी जहां रहती है, जहां बहती है, उस एरिया को सप्लाई करती है. यस, एट द नॉर्थ साइड देयर इज अ गंगा रिवर, सो गंगा विल सप्लाई ऑल द नॉर्थ साइड स्टेट, एंड एट द साउथ साइड देयर इज अ कृष्णा कावेरी गोदावरी, सो कृष्णा कावेरी गोदावरी दे विल सप्लाई द तमिलनाडु केरला साइड. Yes, Ganga will never supply the Tamil Nadu, Kerala, and the Krishna Kaveri Godavari, it will never supply to the UP area. In the similar way, head and neck face part, it will get the innervation. It will get the our innervation by which fiber? Yes, it is close to the T1. So T1 is coming and it is supplying the sympathetic innervation to the our head neck part. So try to understand, sir. Suppose this is our orbit. Agree? Yes, Uzma. This is our orbit. I am making the eyeball. Sir, this is the pupil. Agree beta? Clinical integration. Fine. So we all are aware there is our upper eyelid and lower eyelid. Within the upper eyelid there is a one muscle, superior tarsal muscle, and also here is the inferior tarsal muscle. Upper eyelid is more prominent, lower eyelid is smaller. So what I want to tell you, sir, this is our superior tarsal muscle within the upper eyelid. Yes, it is our deep part of the levator palpebrae superioris. Also it is known as in ophthalmology as Mueller's muscle. Agree beta? It is not given in the BD Chorossia, but it will clear your concept. What is the nerve supply? Sir, it is involuntary muscle, so it is supplied by the T1. What is the function? When it contracts, it causes elevation of the eyelid, so your eyelid is open. But if there is a Klumpke's paralysis, so T1 is getting damaged, superior tarsal is getting damaged, so you will find, sir, there is the ptosis. Agree everyone? Due to the damage of the T1, the superior tarsal muscle is paralyzed. Superior tarsal is responsible for the opening of the eyelid. So eyelid is not able to open, it is getting down. So this is the drooping of the eyelid, that is the ptosis. ओके बेटा, कॉन्सेप्ट जब बनता है तो अंदर से खुशी होती है. दिस इज द योर कॉन्सेप्ट, इट इज वेरी इंपॉर्टेंट. और ऐसे आंसर आप करते हो तो बेटा आप गोल्ड मेडल की तरफ बढ़ोगे. मुझे आज भी याद है 2019 की बैच, द लॉकडाउन बैच, व्हेन वी स्टडीड ऑल अक्रॉस द इंडिया एंड दे गॉट द टू मेनी गोल्ड मेडल्स. सो जस्ट remember this concept, you will also get the very nice marks. Now see, in our orbit at the back side there is a one muscle. What is the name beta? Sir, it is our orbitalis muscle. Yes, what is this? Yes, this is our orbitalis. यस, रट्टा मारा था. यही हम फर्स्ट एमबीबीएस के साथ ऐसा होता है बेटा, बहुत ज्यादा हम कॉन्सेप्ट नहीं बना पाते, क्लिनिकल इंटीग्रेशन हो नहीं पाता, तो हम रट्टा मारते हैं. बट नाउ योर कॉन्सेप्ट इज क्लियर, एंड व्हेन यू विल गिव दिस आंसर, दिस इज द लेवल ऑफ द फाइनल एमबीबीएस आंसर. ओके, यू विल गेट द वेरी वेरी नाइस आंसर. सो वेरी नाइस उजमा, थैंक यू फॉर योर कमेंट. नाउ सी ऑर्बिटलिस. सर, it is involuntary muscle, it is supplied by the T1. So if there is a damage in the our Klumpke's paralysis, T1 is getting damaged, this orbitalis is getting paralysis. Yes, it is supporting the eyeball from the back side. So if there is the damage to the orbitalis, the back support of the eyeball is lost, so it will result in the, yes, back shifting of the eyeball. That is our, yes, anophthalmos. What you have to remember? Sunken eyeball. Yes sir, this is sunken eyeball. This sunken eyeball is also known as anophthalmos. Okay, correct beta? This is sunken eyeball is also known as anophthalmos. But one update from the standard textbook of the our ophthalmology, remember, it is told as apparent anophthalmos. What I want to tell you, sir, there is the our one term, apparent anophthalmos. Sunken eyeball is there, apparent anophthalmos. It is not the true anophthalmos. This is the one update. Okay, so there will be the MCQ. Yes, question is, all are components of Horner's syndrome. Let's see the question for your next pattern, controversial question. A, B, C, D. Ptosis, meiosis, and hydrosis, and anophthalmos. What is your answer? There will be the controversial question, who is wife of Salman Khan? Option will be Aishwarya Rai, Zareen Khan, Option will be the Katrina Kaif, Lulia, Jacqueline Fernandez. Yes, you all know none is the answer. Also, you can say all are the answer, but such options are not given. All are the component of the Horner syndrome, except, what is the question? Except. Now you have to opt the single best answer for your next pattern, for your NEET PG, for your INICT. What you will mark? I told you this one, update from the your Kansaki textbook. Yes, apparent anophthalmos. So remember, according to it, anophthalmos you can mark. Actually, there is no true anophthalmos due to ptosis. Due to ptosis, it appears like eyeballs are getting sunken. Agree, beta? Yes, your answer is D. Correct, Ujma. Correct, beta. So this is the point. Now try to understand. There is a sweat gland. Yes, sir. At the head neck part, there is the our sweat gland. आपको पता है whenever we are looking the lion, we are getting the sweating. शेर को देखते ही हम पसीने से तरबतर हो जाते हैं. Yes. Why? Because when we are looking the lion, there is a sympathetic stimulation, T1 stimulation, which is causing activation of the sweat gland. Yes, sir. Sweat gland, they are supplied by which nerve? T1. So now in our Klumpke's paralysis, yes, sir. In our Klumpke's paralysis, there is a damage to the T1. So there is a damage to the sweat gland, and due to the damage in the sweat gland, sir, there is our no sweating, which is known as anhydrosis. Okay, hydrosis means water, but this is the anhydrosis, loss of the watering. Getting the point, beta? Okay, so this is the another fact. Now try to understand. This T1 is also supplying to the one muscle in the eyeball which is responsible for the dilatation. Yes, that is our dilator pupillae. Getting the point? Yes, sir. Dilator pupillae. But when the T1 is damaged in Klumpke's paralysis, dilator pupillae is getting paralysis. So that's why there is the constriction of the pupil. That is also known as meiosis. So you are getting all the points. Yes, sir. There is our ptosis. Correct, sir. There is our, yes, meiosis. Sir, there is our anhydrosis and anophthalmosis. Better to say, yes, apparent anophthalmos. One more component you will look, that is your, yes, loss of ciliospinal reflex. You will find this point in your physiology. Okay, so this is your homework. What is the loss of ciliospinal reflex? You have to tell me in the next session tomorrow. So what I want to tell you, sir, due to the T1 damage, making the notes for all of you, there is the paralysis of the superior tarsal. That's why there is the ptosis. Sir, there is the paralysis of the orbitalis. Due to the orbitalis paralysis, there is our sunken eyeball. You can say anophthalmosis. Notes for all of you. Yes, there is the damage to the our sweat gland activity. That's why there is anhydrosis. लिख लो बेटा, ये सब आपको एग्जाम में लिखना है. ऐसा आपने लिख दिया तो गोल्ड मेडल है आपका. यस, अगर आप इस लेवल का वाइवा में आंसर करते हो तो बेटा ये आप फाइनल एमबीबीएस के लेवल का आंसर कर रहे हो, डेफिनेटली यू विल गेट द गोल्ड मेडल. ओके, नाउ व्हाट यू कैन सी, इफ देयर इज अ डैमेज टू द आवर डायलेटर पुपिllae, if due to the damage to the T1, so there is our meiosis. And the fifth component, which is your homework, that is, yes, loss of ciliospinal reflex. It is given in your physiology textbook in reflex chapter. So remember this, all the points. Hope you all are enjoying. अगर बेटा मजा आ गया इस कॉन्सेप्ट को लर्न करके तो जस्ट गिव मी द फायर, हार्ट, इमोजीज, एनी काइंड ऑफ द इमोजीज. यस, ये ऑनलाइन क्लासेस और इस ऑनलाइन क्लास में याद रखना, मुझे ये नहीं लगना चाहिए कि मैं कैमरे को पढ़ा रहा हूं, आपको ये नहीं लगना चाहिए कि आप मोबाइल से पढ़ रहे हैं, और इस चीज को ब्रेक करेंगे हमारे इमोजीज. सो रिमेंबर, माय हार्ट, माय फ्लावर, माय क्लैपिंग, माय थम्स अप फॉर ऑल ऑफ यू. ओके, सो yes, thank you Uzma, Shreya, Dilip. So I got one new pioneer of our this batch, Dilip Kumar. Okay, yes, thank you Dilip. Yes, Richa is here. Thank you beta. So this is a beautiful concept. Now this is the one table for all of you for your exams. Sir, difference between the os paralysis and Klumpke's paralysis in tabular form. Nerve roots involved in os paralysis C5 C6, while the Klumpke's paralysis C8 T1. Yes, sir. Muscle paralyzed, you can see deltoid, supraspinatus also, infraspinatus also, because supraescapular nerve has gone. Okay, yes, biceps brachii, brachialis, brachioradialis, superior, and extensor carpi radialis longus, because radial nerve is involved. And Klumpke's paralysis, all intrinsic muscles of the hand, because ulnar nerve is damaged. Ulnar nerve is the musician nerve which is supplying the short intrinsic muscles of the hand. And position of the upper limb in os paralysis, sir, policeman tip or porter tip or waiter's tip, but here the ulnar claw hand in Klumpke's paralysis. Beautiful table for all of you. And sensory loss you will see along the outer aspect of the arm. Why? Because C5 C6 has gone, so it is at this our lateral part of the arm, that's why. But in Klumpke's paralysis, along the distribution of the ulnar nerve T1, especially C8 T1, so on the medial side. Okay sir. And autonomic sign, T1 is not damaged in the os paralysis, so no autonomic sign. Okay, but sympathetic nerve is damaged, so autonomic sign T1 damage. Horner syndrome is present in the Klumpke's paralysis. Otherwise, you can remember Horner syndrome. Yes, it is present in the Klumpke's paralysis. Horner syndrome is absent in the os paralysis. So simple. Now, few update for all of you. Remember, beta, if you want to get extra, then you have to do extra. Tell me, what is your update for the root value of the ulnar nerve? What is your answer? This is the MCQ. Okay, so try to answer this question. Root value of the ulnar nerve: C5, C6, C7. Option A. Option B, C6, C7, C8. Option C, C7, C8, T1. And option D, C7, C8. याद रखना, whenever there is any update in the Gray's anatomy, the Bible of the anatomy, the Ramayana, the Gita, the Quran of the anatomy, then you have to follow that one. Okay? Yes. Very nice, Shreya. Very beautiful answer from the physiology. Correct. On pinching on nape of the neck, there is a dilatation of the pupil. This is the normal phenomena. Okay? जब कोई बहुत ध्यान से पढ़ रहा है लाइब्रेरी में और जाकर के आप हो ऐसा करके डरा देते हो, वो डर जाता है. डरता है तो प्यूपिल में डायलेटेशन होता है. अदरवाइज कोई पेशेंट है, कोई आदमी है जो चुपचाप कॉन्सेंट्रेट कर रहा है और आप क्या कर रहे हो, पिंचिंग ऑन नेप ऑफ द नेक, डर लगता है, सिंपैथेटिक स्टिमुलेशन होता है, दैट्स व्हाई दिस इज लीडिंग टू द डायलेटेशन ऑफ द प्यूपिल, देयर इज अ मिड्रिएसिस. ये नॉर्मल है. बट इफ T1 इज डैमेज, then you are doing the pinching of nape of the neck, there is no dilatation of the pupil, but still there is a meiosis. This is loss of ciliospinal reflex. नाम को तोड़ो और सोचो. Cilio means ciliary body, spinal means spinal cord. So there is a one reflex in between the ciliary body and spinal cord. Ciliary body means dilated pupillae and spinal cord means T1 segment. So this is your ciliospinal reflex. You will learn in your physiology part. Okay? Yes, ipsilateral. You are right. Perfect, Ujma. You are right. C7, C8, T1. See here. There are the lots of the update. I am going to tell you. But this is the Gray's anatomy. C5, C6, C7, C8, T1. Correct, sir? We had seen C5, C6, they are meeting, making the upper trunk. The C7 is making the middle trunk. C8, T1, that is making the lower trunk. Now you can see it is dividing into the our different lateral cord, yes sir, posterior cord, medial cord. Fine. We are finding the ulnar nerve. Can you see? Sir, it is ulnar nerve. Sir, ulnar nerve is coming. Yes, sir. Ulnar nerve, it is formed by the our C8 and T1. We are touching the Gray's anatomy also. Okay, so root value is the C8 T1. But can you see the few fibers are coming from our C7 also. So according to the Gray's anatomy, page number 926, Gray's anatomy 42nd edition, the root value is C7 C8 T1. So this is the best answer. Yes, Shreya, you are right, beta, C8 T1. But according to the Gray's anatomy, C7 C8 T1. And in AIIMS exam, if you are not, if next pattern, our changing exam pattern, any kind of the pattern, you are following the our Indian textbook, they will say C7 C8. But Gray's anatomy is saying the C7 C8 T1. So in that situation, you will get negative marking. According to the Gray's anatomy, 41st as well as 42nd edition, the C7 is also participating. So remember this one. Now, few more update. Remember, many times you will get confusion. Axillary nerve root value C5, C6, C7. No, the Gray's anatomy 42nd edition is saying at the page number 877 and 924, the root value is only C5, C6. Up tak 56 nana partaker. So remember, axillary nerve only the C5, C6. Musculocutaneous nerve, page number 880 of the Gray's anatomy 42nd edition, it is saying the C5, C6 also the C7. So don't get confusion. Okay, different textbook, different things are there, but ultimately you have to follow the Bible, the Quran, the Gita, Ramayana of the anatomy. Yes, Gray's Anatomy 42nd latest edition. Also, in many textbook you will see the pectoralis minor. It is supplied by lateral pectoral nerve only. But Gray's Anatomy page number 910, it is directly saying it is a hybrid muscle. Any muscle which is having the double nerve supply known as hybrid muscle, it is supplied with the lateral and the medial pectoral nerve both. Remember, few students says that in few textbooks the pectoralis minor is supplied by lateral pectoral nerve only, it is given. But remember, Gray's Anatomy you have to follow. Okay, so don't put any kind of the controversy. Yes, you can. It is not easy to study the Gray's Anatomy. It is very thick. Yes, it is very thick. Gray's Anatomy is very thick. We are not able to study this all the textbook. But what I want to tell you, see here, this is the Gray's Anatomy 42nd edition. Sir, how can we learn this textbook? You have not to learn. You have to see the images. You can follow the students edition. And we the teachers are for all of you. The Cerebellum Academy is with you. We are going to describe what you have to follow from this Gray's Anatomy. Yes, you all are having the so hectic schedule that you will not be able to read this Gray's Anatomy, but we will help you what you have to see. Okay, so hope you all are enjoying this session. Okay, now see here, this is the knowledge. What I want to tell you, sir, this is our dorsal root, this is the ventral root, both are uniting making the trunk. This is the dorsal rami. Remember, this dorsal rami is not participating in formation of the brachial plexus. Sir, this ventral rami of the C5 to T1 is participating in formation of the brachial plexus. So this is the concept you can follow. At the last of this session, remember beta, if you want to be strong, learn to enjoy being alone. This is the very crucial time. You all are having the exam very close. लेकिन याद रखना, अगर आप तेजी से चलना चाहते हैं तो अकेले चलिए. बट इफ यू वांट टू गो फॉर द वेरी लॉन्ग डिस्टेंस, बहुत दूर तक जाना चाहते हैं जिंदगी में, तो दोस्तों के साथ चलिए, फैमिली के साथ चलिए, अपने सोसाइटी के साथ चलिए. यू विल गो वेरी वेरी लॉन्ग डिस्टेंस. इसलिए बेटा मैं आपको कहना चाहता हूं, शेयर द नॉलेज. दिस इज द वेरी क्रूशियल टाइम. दोस्त वो होते हैं, दोस्त सबसे बेस्ट टीचर होते हैं. हॉस्टल में पढ़ाई कीजिए, दोस्तों के साथ पढ़ाई कीजिए, डिस्कस कीजिए. ओके, इट विल इनहेंस योर नॉलेज. उसने जो पढ़ा है वो आपको बताएगा, आपने जो पढ़ा है वो उससे शेयर करेंगे. एग्जाम का जो स्ट्रेस है वो कम होता है. सो दीज आर द लाइन्स फॉर ऑल ऑफ यू. होप यू ऑल एंजॉयड दिस सेशन. At the last again the same thing I want to tell you, सिर्फ हंगामा खड़ा करना हमारा मकसद नहीं. कोशिश है कि सूरत बदलनी चाहिए. तुम्हारे सीने में नहीं, हमारे सीने में ही सही, या फिर हमारे सीने में नहीं तो तुम्हारे सीने में ही सही. कहीं भी हो आग, लेकिन ये आग जलनी चाहिए, ये आग जलनी चाहिए, ये आग जलनी चाहिए. तो सेरिबेलम एकेडमी की तरफ से हम लोगों ने एक बढ़िया सी शुरुआत की है. अभी हम 50 हैं, फिर हम 100 होंगे, फिर हम 500 होंगे, फिर हम 1000 होंगे, फिर हम 10,000 होंगे. ये मेरा आपसे वादा है. एक बहुत ही बढ़िया ग्रुप बनने वाला है. हमारे 2 बैचेस हैं बेटा. एक अभी एग्जाम गोइंग बैच है, उसके लिए हम एग्जाम हेल्प के लिए छोटे छोटे सेशन करते रहेंगे. एनाटॉमी के लिए, फिजियोलॉजी के लिए, बायोकेमिस्ट्री के लिए. यस, एनाटॉमी का फील्ड मैं डॉक्टर श्रीकांत वर्मा संभालूंगा. बायोकेमिस्ट्री के लिए डॉक्टर इस्माइली पूर्ति मैम आएंगी, और इसके साथ में फिजियोलॉजी के लिए डॉक्टर पूजा निगाने मैम आएंगी, जो आप लोगों की हेल्प करेंगी एग्जाम के लिए. और नई बैच जो कि 1 अगस्त से आ रही है, लेकिन ये ऑल इंडिया की काउंसलिंग है, स्टेट काउंसलिंग भी उसके बाद होती रहेगी. तो जो नई बैच आ रही है वो बच्चे भी जुड़ते चले जाएं. उनके लिए हम बढ़िया सा डिटेल कोर्स करेंगे और एक एक चीज समझेंगे. लेकिन जो बच्चे अभी एग्जाम के पास हैं बेटा, अभी हम क्विक रिवीजन सीरीज आप लोगों के लिए कर रहे हैं. बीच बीच में हम यूट्यूब के थ्रू आप लोगों के लिए आते रहेंगे, और हमारे रिकॉर्डेड वीडियोस भी ऐप में अवेलेबल हैं, जो आपके लिए बहुत हेल्पफुल होंगे. सो थैंक यू वेरी मच. गॉड ब्लेस यू ऑल. एनी डाउट प्लीज आस्क बेटा, विदाउट हेजिटेशन. कोई भी डाउट सिली नहीं होता, बिल्कुल विदाउट हेजिटेशन आप पूछ सकते हैं. प्लीज आस्क बेटा डाउट.